A bedridden patient, a bedridden patient can recover in 6 days of Parkinson's, and a 22 years paralysis patient, a very bad injury, bedridden for 22 years, can recover in 2 days. 20 days. How many of you believe this? After 22 years, how many of you believe a paralysis patient can recover? Shivani, what is your opinion?
It's very possible, sir. I have seen so.
Shivani, what is your opinion?
Sir, with your teaching, I can say it can be recovered.
If you remove me, how much is the chance?
Not possible, sir.
Dharam, how much is the chance of recovery of a patient in advanced Parkinson's stage?
I have no experience about this patient.
Parkinson, you are not experienced?
Yes, sir. I have no patient of the Parkinson disease, sir.
And paralysis?
Yes, sir.
So I like to introduce to you a patient who is a Parkinson's patient with paralysis. Two patients are there today. I'm going to introduce you with advanced brain mapping and all. This patient has come to a significant stage of recovery. This patient was admitted in Manipal Hospital, Bangalore, right? And they decided that they will not go for DBS because the patient was unfit candidate for DBS, right? This was an unfit candidate for DBS. DBS means what? Deep brain stimulation. So today you will see a very beautiful case which we have done, and the outcome of these cases have been obtained in a very few days. See, 22 years and 20 days, right? 7 years of Parkinson bedridden stage, very difficult to walk, and 5 days of recovery. This is a video made on the fifth day of the patient. How many days? Fifth day of advanced stage of Parkinson. And you can see a significant recovery has been done with advanced stem cell therapy. So here we can understand traditional method of recovery if integrated with modern approach, right? We can see a significant recovery in those cases. And when we implant deep brain stimulation at a lower cost, because they are covered in insurance, right? So you will see a zero cost DBS is being done in a charitable hospital of Kim's Karat with the best ability and best of the best approach, with best of the best surgeon. You will see what the patient is what significantly recovered. What will you see? Significantly recovered. Now, this implant will be with the life of the patient for 22 years, and you will see the patient is very good. But before surgery, you have to make a patient fit candidate. So right now, the patient attended, and we have planned to move the case. 170 years case we are doing for spine surgery. We are taking another case for for discectomy. We are taking another case of fixation at 72 years. And all these patients are totally okay right now. But for future prevention and degeneration, we are taking these cases to Karat, and you will see that the outcome from Karat, you will see the videos. They are really doing fine, I tell you. Now you see the status after 5 days, and after 1 month, you will see the status. Before putting to Karat, after putting to Karat, you see the status of the patient, right? So this is a patient of 22-year paralysis patient. Huh? This is MK Sastry. Can you hear the voice? Can you hear the voice? The video and the voice, can you hear?
Yes, sir. It is loud and clear, sir. Your voice loud and clear.
Yes,
No, no, video
Prasad, but
voice
you have
clear.
paused the video. Play the video, Sastry.
Yes, sir. Video is with voice.
Lot of questions are coming to our mind.
Video
Yes, sound
also
is
बहुत
okay.
सारे
okay.
सवाल आते
Sound is
दिमाग
okay.
में when we work in the neuro recovery center. सबसे बड़ा बात है 22 साल पुराना पेशेंट कभी रिकवर हो सकता है from quadriplegic state who was totally bedridden. Can you believe that एक पेशेंट 22 साल पहले पैरालिटिक हुआ था. He had injury and then we said that this patient was paralyzed for wheelchair in. कितना साल wheelchair पे रहा?
1 year
Huh?
22 years.
So he was on wheelchair for 22 years, and now you can see in a quadriplegic state he came, and you can see report किसको? Suggesting of suppression of involving right posterior parotid suggestive of chronic infarct and gliosis. Ventricle system is prominent and biventricular white matter and cell hypertensis. Atrophy of the cerebellum and midbrain pons noted, prominent premencephalic cisterns and cerebral folia. So you can see attenuated caliber pecusity of branches noted involving bilateral middle cerebral arteries. ACA, MC are supplied by PCOM and ACOM. So you can see number of changes are there. I will put this on record, the file, and then you can see that the condition of the patient is the ventricles are very prominent. It's a patient who was bedridden for 22 years, and now you can say, अभी कितना दिन हुआ इसको यहाँ? How many days? In 20 days, this patient has gone to significant recovery. आप अपना पैरों को bend कीजिए, पैर bend कीजिए. एक को छोड़िए. वीडियो छोटा क्यों करना?
पहले एक करने के बाद एक करो. ये 10 बार करो. ऐसा अंदर बाहर.
हाँ, एक को एक बार उठाओ. गुड. हाँ, हाँ गुड.
अभी बाहर करो उसको.
इधर करो, मेरी तरफ करो.
हाँ ऐसा.
गुड.
ये ऊपर करो. वेरी गुड. अभी ये बाहर करो इस तरफ मेरे हाथ से. वेरी गुड. अभी ये अंदर खींचो. हाँ वेरी गुड. नाउ अभी एंकल्स को अंदर ऐसे बाहर करो. एंकल्स ओनली एंकल्स को. हाँ वेरी गुड.
So you can see common perineal wall there was NR, not reachable. Now you can see. This is MK Sastry, Institute of Neuroscience, Sastry Neuro Rehab. This is MK Sastry. We have said lot of questions are coming to our mind. बहुत सारे सवाल आते दिमाग में when we work in the neuro recovery center. सबसे बड़ा बात है 22 साल पुराना पेशेंट कभी रिकवर हो सकता है from quadriplegic state who was totally bedridden. Can you believe that एक पेशेंट 22 साल पहले पैरालिटिक हुआ था. He had injury and then we said that this patient was paralyzed for wheelchair in.
The video is not visible. We have your screen.
Huh?
22 years.
I am
He
not
was on
seeing
wheelchair
the
for
video.
22 years.
I'm having the audio of the video. But
In a quadriplegic state, he came, and you can see. This is MK Sastry, Institute of Neuroscience, Sastry Neuro Rehab Hospital, Hyderabad. आप देख सकते हैं we get every day very critical cases. This is one among them. In
you
the
have to
advanced stage
share
of
the
Parkinson.
video too, sir.
आप देख सकते हैं in advanced stage of Parkinson we have a lot of tremors. This is MK Sastry. We have said lot of questions are coming to our mind. बहुत सारे सवाल आते दिमाग में when we work in the neuro recovery center. सबसे बड़ा बात है 22 साल पुराना पेशेंट कभी रिकवर हो सकता है from quadriplegic state who was totally bedridden. कैन यू बिलीव दैट एक पेशेंट 22 साल पहले
It is okay now, Sastry.
Can you see the video?
Yes, we can see the video now. Just
And
play.
the voice?
The voice is okay.
Voice?
Just play. Just play. The voice is okay.
He had injury, and then we said that this patient was paralyzed for wheelchairing. कितना साल wheelchair पे था?
1 years.
Huh?
22 years.
So he was on wheelchair for 22 years, and now you can see in a quadriplegic state he came, and you can see report किसको? Suggesting of suppression of involving right posterior parotid suggestive of chronic infarct and gliosis. Ventricle system is prominent and biventricular white matter and cell hypertensis. Atrophy of the cerebellum and midbrain pons notal metronate cephalic systems and cerebral folia. So you can see attenuated capacity of branches noted involving bilateral middle cerebral arteries. ACA MC are supplied by PCOM and ACA. So you can see number of changes are there. I will put this on record, the file, and then you can see that the conditions of the patient is, the ventricles are very prominent. It's a patient who was bedridden for 22 years. And now you can say,
कौन सा जैकेट का
how many days? 20 days. This patient has gone to significant recovery. आप अपना पैरों को bend कीजिए, पैर bend कीजिए.
हाँ, ब्लैक कलर का सही रहेगा.
एक को छोड़िए.
एक करो. पहले एक करने के बाद एक करो. ये 10 बार करो. ऐसा अंदर बाहर.
हाँ. एक बार को उठाओ. गुड.
उसमें से कुछ भी अच्छा लगा तो देख लो.
बाहर करो.
ब्लैक कलर का मीडियम साइज का देख लो.
हाँ ऐसा. ये ऊपर करो.
हाँ.
वेरी गुड. अभी ये बाहर करो इस तरफ मेरे हाथ से. वेरी गुड. अभी ये अंदर खींचो.
हाँ, पैंट 30.
हाँ वेरी गुड.
कमर 30. 28
अंदर ऐसा
30.
बाहर करो. एंकल्स ओनली एंकल्स को.
ठीक है.
So you can see commonly perineal nerve all there was NR, not reachable. Now you can see all the nerve and muscle functioning has been there. Muscular atrophy, जो muscles loss हुआ था, we have regained it to a significant level. Now you can see upper limb recovery also. हाथ को उठाओ, पूरा उठाओ पहले.
हाथ चुप.
हाँ. पहले और पीछे ले जाओ. Good.
वेरी गुड. और नीचे करो.
नीचे करो.
ये हाथ करो. वेरी गुड.
नीचे लाओ.
अभी ऐसा अंदर ले लो.
ऐसे लो.
नेक्स्ट वीडियो उसका ऊपर ही.
अंदर ले लो.
नेक्स्ट वीडियो उसका ऊपर ही.
फिंगर्स. वेरी गुड. अभी ये ऐसा अंदर लो. वेरी गुड. बाहर ले लो. फिंगर्स. ऊपर फिंगर्स ऐसे करो. फिंगर्स. वेरी गुड.
So you can see the fine movements and everything has come. Difficulty is still there in walking.
कमर उठा.
कमर उठा. हाँ. 30 seconds.
आओ ऊपर कमर उठा.
हाँ. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Now you can see an incredible recovery has been seen in a 22-year-old patient with massive brain damage. You can see lot of osteophytes has been formed in the knee. These osteophytes also have been formed in the knee for long-standing case. Luckily, we don't have any bed sore and all. And now you can sit independently. पाँव को fold करो, अपने fold करिए बैठो, आप fold करो.
ऊपर देखो, उधर देखो. वेरी गुड. बेड सेट. पैर उधर कर लो आराम कौन निकला था थोड़ा आगे जाओ ऊपर देखो वेरी गुड ऊपर देखो सीधा
मेरे को देखो. So you can see a significant recovery has come in a 22-year-old paralysis patient, 22 साल पुराना paralysis patient. He had a road traffic accident, and his MRI report will be attached to the video, and we can find the recovery is very significant at this level, and we can see the patient is very significantly improved. All muscle power has come. Now only walking pattern and gait pattern and fine movements in walking has to be achieved. Otherwise, he is able to independently sit, and we have started training him in gait posture, and only gait walking is trained kar diya. But otherwise, if you see, as per this MRI report, with small vessel ischemic changes, atrophy in brain, strain, cerebellum, prominent forces. Here you can see, this is a 22-year bedridden patient who was 22 years. So when he was supposed to be a model, he was going to Dubai for modeling. And 3 days before going to the trip, he had a road traffic accident. And imagine, you was 22 years on wheelchair in a non-mobilized stage, in a vegetative stage. Now you can see, what is your comment about this patient's recovery? In 20 days. So 20 into 7 equal to 140 hours. In 140 hours, what is your comment about this recovery? What will you say about this recovery? Dharam, what is your comment? Come on, folks, here.
So with the
It's
technique
very good
used,
recovery, sir. All muscles power is coming and
Now we are putting on gait walking.
yes, sir, and fine moments are there.
Fine movements in the finger has come, you see?
Yes,
Both
sir,
the
and
fingers are,
elbow and wrist also is working fine.
yeah, elbow, wrist, everything is working. So now you see, because of the lack of approach, you put the patient 22 years on his life on the bed. He has lost his entire life, right? Now, don't you see it is a life imprisonment? Eh? And I took only 22 days to bring this stage. Now you'll see another stage of Parkinson. So I'm showing you this video because a lot of people are asking me, what is the outcome of DBS? What is the outcome of good surgery? I want to show you that part also. This stage also you see, post-surgery from Kim's Karat also you see, and recovery of the patient also you see. This is MK Sastry, Institute of Neuroscience, Sastry Neuro Rehab Hospital, Hyderabad. This
can
is
you see the video?
Sastry, Institute of Neuroscience,
You have to
Sastry
share
Neuro
the
Rehab
video,
Hospital.
Sastry ji.
You have to share, na?
The video.
I am sharing it. Did you see the video?
Yes, the video is showing now. Play. Let's hear the sound.
Now?
Yes, it's all right.
We get everyday very critical cases. This is one among them in advanced stage of Parkinson. आप देख सकते हैं in advanced stage of Parkinson we have a lot of tremors, voice aphasia, speaking difficulty and all these things. And she was rejected for DBS. इनको deep brain stimulation के लिए reject किया गया था. And finally the case has been extracted at KIMS Karak. So now the patient is doing fine, and you can see that she is independently walking, and you can see independently sitting. Ma and hand is correct.
check button.
Saka.
Open here. Very good.
आपको ऐसे ऐसे करनी है.
मुकेला टच है नोज में. ये कितना टच है?
Say, साथ say. Right.
Good.
मल्ले नोज.
हाँ.
इचे बड़ा
Finger को. हाँ. Touch like this.
ఇక్కడ టచ్ చేసి మళ్ళీ టచ్ చేసి.
Itala.
టచ్ చేయండి.
Touch.
Very good.
So you can see neurocoordination is done, neuromonitoring has been done with the patient. Now you can see she is walking independently with the walker. पहले से आप कैसा लग रहा है इसको ये पूछो.
వీడికి రాకముందు నుంచి ఇక్కడికి వచ్చినాక మీకు ఎలా అనిపిస్తుంది? అంతకుముందు ఎలా ఉంటుండే ఇప్పుడు ఎలా ఉంది మీకు?
అంటే ఇప్పుడు చేయించుకొని పోతే ఉండదు మనం మామూలు వస్తాయి
అప్పటికంటే ఇప్పుడు ఎలా ఉంది మీకు?
కొంచెం
బెటర్ సార్.
She is feeling better, huh? Yeah. The moment she is feeling better, we'll try to taper the dose of the medicine.
మీకు కొంచెం మంచిగా అవుతున్న కొద్దీ మేము మెడిసిన్ కొంచెం తగ్గిస్తాం డోస్ని. డోస్ తగ్గిస్తుంటే మీకు ఇంకా బెటర్ అవుతుంది. ఎన్ని రోజులు అవుతుంది మీరు వచ్చి? 4 days.
Treatment कितना दिन हुआ?
4 days.
4 days. So you can say in 4 days of the treatment, we have got a very good recovery of the patient. उसका नाम पूछो. नाम पेरू माँ.
ఏం పేరు అమ్మా మీది?
ఏం పేరు?
కేజయమ్మ
हाँ?
కేజేయమ్మ.
కేజయమ్మ
हाँ. कहाँ रहता पूछो?
ఎక్కడ ఉంటారు మీరు?
అనంతపూర్
Anantapur. Right. Now walk with the walker.
స్టాండ్ నిలబడండి.
బాగా మెడ పైకి చక్కలు పడు. చక్కలు ఉంచుకో.
చక్కగా నిల్చోండి.
మెడ పైకి మెడ పైకి.
Walk, huh?
చక్కలు ఉంచుకో.
స్ట్రైట్ కూడా. స్ట్రైట్.
Walk. Straight.
ముందు చూడండి.
ముందు.
See my nose.
ముక్కు చెవు.
इसका नोज देखो. हमारा नोज क्या देखेगा? इसको देखो. इधर आओ. अपना हस्बैंड को देखो. इधर आओ. हाँ, इसको देख के चलो. हाँ, इसको देखो पापा. You walk. हाँ. So you can see a 5 years of Parkinson patient, mobilized very better, fit for DBS, and we are shifting him to Karak very soon. Next month, deep brain stimulation surgery will see, and you will see the patient walking very finely, very nicely, and for next 20 years we can say that she will live a very good life. Narvandi ma'am, Nadu.
చక్కలు ఉంచుకో.
Walk fast.
చక్కలు ఉంచుకో.
Chako. Pako. Go fast. No. Go.
చక్కలు ఉంచుకో. స్ట్రైట్ గా తల పైకి ఎత్తు.
Tala paiko.
తల పైకి ఎత్తు.
Very good.
తల పైకి ఎత్తు.
So you can see no resting tremor, nothing has been seen in this case. Patient is doing very fine, and in 4 days of the treatment, we got a significant recovery. केवल 4 दिन में हम लोगों ने ये recovery को sustain किया. Now she is a fit candidate for DBS, deep brain stimulation, and deep brain stimulation will be done by Dr. Ayub Cherian at Karak, one of the legendary neurosurgeon. Neuromonitoring has been done right now, and she is improving day by day, and we can see that this case is coming good. Parkinson's case advanced stage.
She's an advanced case of Parkinson's. She has been treated here and she is doing really very well. And she's able to walk. There are absolutely no resting tremors, and she's doing very well.
And now voice also has become good. Naam देखो. हाँ?
జయమ్మ
हाँ, voice is good.
కేజయమ్మ
Husband name?
వెంకటేశ్వర
How many children you have?
అదే హరి
Balaji Hari. 2 children. Married or unmarried?
మీ ఊరేంటి?
పెళ్ళైపోయింది
మీ ఊరేంటి? అనంతపూర్.
हाँ, इसका शादी को कितना साल हुआ पूछो?
మా పెళ్ళైంది
పెళ్ళై ఎంత కాలం అవుతుంది?
పెళ్ళైంది
Arranged marriage, love marriage?
అరేంజ్ మ్యారేజ్ లవ్ మ్యారేజ్?
So she is cognitively well, smiling, she has improved, her voice is doing good, now she has become very fine, and she is at the advanced stage of Parkinson, and we have revived this patient in just 4 days. What is your statement? Revival in 4 days?
very quick recovery for a Parkinson's patient of Sastry.
Parkinson case improving in this 4 days.
4 days is a very rare thing that we can see. And she has improved very, very walk without a walker.
We'll make her walk without walker.
Walker
In 1 month, 1.5 months you will walk without walker. కొంచెం టైం పట్టాలా
బ్రెయిన్ కదా ప్రాబ్లమ్
కొంచెం టైం పట్టాలా నడవండి without walker.
ఓకే.
So here you can see a very good case and improvement in this case of Parkinson. Significant improvement can be done and patient can be fully improved. A significant improvement can be done with DBS. Patient was, when they came, she was not in a position for DBS. Now we can see she is in a position. Voice efforts are very good. ये कितना finger है?
2, 3, 4, 5, 6, 7,
7.
9, 1, 2.
Her voice is very good.
Cognition is good.
Cognition is very good. She is very good and she is now becoming a fit candidate. In 4 days, it a significant improvement has come. When the day she came, she was very depressed. Arranged marriage, love marriage. भगा के लाया ना, शादी करके लाया. Now you can see she is smiling.
So what is your comment about this patient? Physios come up, doctors come up. Folks come up here. Only I will speak or what? What is your comment? Shivani, speak something. Chappandi Baba.
Yes, sir.
Chappo.
Sir, awesome निकलता है और क्या? What else? It's amazing to see the recovery at a very fast speed.
So we have treated her only 28 hours. How many hours?
28
Unfit
hours.
candidate. Unfit candidate for DBS has become fit for DBS. In fact, the attenders were not confirmed what we will do. And I was saying, okay, we'll speak after 4 days. Now do you see, as a physician, Sunil, what do you see? Is this a fit candidate for DBS or not? Deep brain stimulation के लिए अभी fit है या नहीं है? Shivani, what do you say?
Sir, according to Shastri sir, anyone is fit.
No. What is your physical status? क्या दिख रहा है?
सर पहले के हिसाब से कंपैरिजन तो बहुत बेटर रिकवरी हुई है, जो कि इट्स वेरी रेयर आप इतनी जल्दी इतने टाइम में इतना अचीव कर सकते हैं, जो कि वैसे नहीं पॉसिबल है अदर देन योर टेक्निक.
हमारा टेक्निक का बात छोड़, वो तो एक नॉर्मल टेक्निक है. There is nothing happened in this 10 degree to 90 degree, 9 pens 10 degree to 90 degree. बस एक सिंपल टेक्निक.
सर
10
इतना
degree to
सिंपल
90
होता तो
degree.
सारे कर लेते.
हाँ?
It's only Shastri sir.
Can we imagine a patient on 25 years on bedridden? Can you imagine this patient going towards death? Can you see your mother progressing towards death? Can you see a patient, your uncle, 22 years on bed? माइक म्यूट करके बोलने से क्या होगा शिवानी? फोन करके बोलो जो
नहीं सर, वो मेरी बिटिया कुछ पूछ रही थी.
बिटिया रानी भी यही क्लास, उसको भी फीस लगा दो बेटा. बिटिया भी क्लास अटेंड कर रही है. एक के साथ 2 फ्री, हस्बैंड और बिटिया दोनों फ्री. Dharan, what is your comment? Let us take few comments and then we'll go to the people. Dharan, बोलो, what do you feel about both the cases? पहला केस के बारे में तुम क्या बोलेगा? What is your observation?
जो पैरालिसिस का केस था, रिकवरी बहुत अच्छी हुई है एंड मसल्स बहुत अच्छा मूवमेंट है. एंड सर
आप इमेजिन करो 22 साल एक आदमी बेडरिडन है.
यस सर, एंड फैमिली सर बहुत सफर
22
करती
years.
है. साथ में सर फैमिली बहुत सफर करती है पैरालिसिस पेशेंट के साथ.
Hmm. And now, what is this approach? Hmm?
सर उसके लिए तो
Yes,
मिरेकल
sir.
ना उम्मीद था पूरा आदमी, वो मौत में
हाँ
जमा था, बेड
हाँ, वो
रिडन है बोले तो मौत में जमा था ना, वो कोई मोमेंट ही नहीं था उसके लिए, उम्मीद ही
राइट।
था पूरा, पूरा
हाँ,
उम्मीद
उन्होंने एक ही बात बोला था, इतने डॉक्टरों को दिखाने के बाद हम लोगों ने उम्मीद छोड़ दी।
हम्म
17 साल से डॉक्टर को दिखाना ही बंद कर दिया।
सर
बराबर।
ज्यादातर पैरालिसिस
उसके
पेशेंट के
लिए
साथ यही होता है, वो सारे डॉक्टर्स बोल देते हैं ठीक है अब नहीं हो सकता।
और अब क्या बोलते हो आप लोग? व्हाट डू यू से
बट
नाउ?
पॉसिबल बिल्कुल है
अरे
सर,
नहीं, आपकी
आपके
मेहनत
पास
है,
से बिल्कुल पॉसिबल है सर।
99% आपकी मेहनत है, वो तो कोई ये ही नहीं कर सकता, बट क्या उसके
नहीं
अंदर उम्मीद था कि मैं वापिस खड़ा होऊंगा, एंड कितने
नहीं, द फैमिली वाज टोटली नेगेटिव। उन्होंने खाली इतना ही बोला था, सर हम लोगों ने हिम्मत हार दिया।
पेशेंट भी छोड़
ये
दिया था पूरा।
अब उन्होंने बोला 22 साल एक पेशेंट पैरालिटिक है। एवरीवन हैज सेड नो। He has visited 15 best neurosurgeons and they said no. अब बोला कि जब तक है तब तक है, आप सेवा करो। नाउ कैन यू इमेजिन 22 years and 140 hours of treatment?
मिरेकल, मिरेकल।
तो कल आपने वीडियो में क्या देखा? मैं वही बता रहा था, जो सच है वही। एकम सत्यम बहुधा वदंती, देयर इज ओनली वन ट्रूथ व्हिच लाइज। दैट इज व्हाट इट सेड इन ग्रंथ साहिब, एक ओंकार करतापुर, एंड दैट इज व्हाट इन कुरान इट इज सेड इंशाल्लाह। इफ अल्लाह वांट्स,
अच्छा,
एवरीथिंग विल हैपन।
वही वही
ही
मतलब
मैं
सर,
ऑलवेज।
जान रही थी कि उसका इन्हें अंदर का अंतर्मन उसका कितना
अब उस पेशेंट का सबसे बड़ा बात है, यू विल सी दैट यू हैव सीन हिम टुडे, आफ्टर 10 days अगेन विल पुट हिज वीडियो एंड यू विल सी ही विल बी एबल टू स्पीक। एक आदमी 22 साल से बात नहीं कर पाया, राइट? 22 साल बेड रिडन था। He could not go for his washroom for 22 years. Now you see, कहाँ से कहाँ गए हम लोग? In Hindi there is a song, you know what? हाय ये क्या से क्या हो गए, सारे सपने कहीं खो
और
गए, हाय हम क्या से क्या हो गए। I don't know the second line. Only I know the first line. And then always I say to the patient, मुड़ मुड़ के ना देख, मुड़ मुड़ के ना देख, मुड़ मुड़ के। Then I don't know. And then when they ask me, sir, how will you illustrate this? Uh, the first song it says, don't see the past. Go on, don't keep your neck rotating towards the past. And second, we say, my all dreams are broken. So in this Indian song. And then they ask, sir, what did you do? I said, Jhumka gira re, Bareili ke bazaar mein, Jhumka gira. These are the only three lines of the song. No. So if anyone asks me, so what did you say? Do I said Jhumka gira re? And then they ask me in Nepali, what did you do? I say Bahu Bahu Ramado. So this is what I say always. See, when your foundation is strong, your mentally is strong. When you motivate others, when you write your notes, you see, Shivani, we started with 5 students in this class, right? Do you imagine we will be associated with 150 neurosurgeons of the world? The day when I came to Gurgaon, did we think like that?
No, sir.
You see, the way you started writing notes, people are asking me again and again. They have purchased pen and now they are asking again and again. Even IPTN is asking your notes and the pen. Now you imagine, he said, I like to practice with this pen and what do you call non-invasive brain stimulation of Sastry. I want to learn this. I said, okay, sir, I'll ask Shivani. And that is why I asked your notes. And it has gone to Chedian and a group of neurosurgeons who wants to introduce and they want to practice this technique. Now you imagine. And more interesting is the principal chief neurosurgeon, who was the head of the Department of Neurorehabilitation in Zimbabwe University, is introducing this subject in his class. And I'm going to Zimbabwe from 15th. So up to 15th I am here. Then I don't know what is the internet connection and all. So if there's any chaos in the group, please manage that I'm on Zimbabwe trip, right? But then we will post our videos in Facebook if possible. Right? What we are doing, how we are managing, how we have done things in Zimbabwe. You will be coming in contact with a lot of South African surgeons. More important is our chairman Kajadi Saab. You see, he could not give a talk, but one simple message of him has brought you so much closer to him and closer us to him. This is what we call the life, and this is what we call the approach. The most important thing when we understand in brain is the neuroplastic changes. Now, if we go with the normal approach, how long we have taken to recover this patient? 22 years for bedridden stage, 15 years on what do you call physiotherapy. Now, if we integrate everything, how many days? 140 hours. What is the harm of integrating it with the physiotherapy? What is the harm of integrating it with the conservative medicines? What is the harm with integrating with stem cell therapy? Any harm? No harm. Whenever you sit in the class, Shivani, notes are important, Baba. People are in high demand. They are always asking me notes, 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 notes. You can give PPT, but notes are always notes. What I will do? From your childhood, you have developed a habit of taking notes. Sir, notes. So whenever I go to university or class, I tell them, take out your notebook and write notes. Note, record, note. So, Shivani, she is my stenographer, you know.
सर वी बिलोंग टू दैट जनरेशन जिसको अभी भी आदत थी कि खुद के हाथ से लिख के जरूर पढ़ना है, चाहे कितना पीपीटी आ जाए, वो जो अपने हाथ से लिखा हुआ है ना, दैट इज द बेस्ट वन.
See, up to now I'm making the PPTs, right? Up to now I'm writing the notes. Up to right, I'm writing all the Facebook posts, right? Up to now I'm editing. Up to now we are making video making. How many support we have in this hospital? If you see, we have only 3 nurses, 4 ward boys, 4 physiotherapists, and we are managing the most critical cases. We are going to 40 IPTs. Now, if you see, putting one patient, that boy whom you have seen on the wheelchair, that boy who came, na, क्या नाम था उसका गुड़गांव में ना? When the first came, they came.
राम जाए.
हाँ?
सर राम की बात बोल रहे हैं.
राम.
यस सर.
राम था क्या वो व्हीलचेयर में बच्चा?
Yes, sir. That young boy, Ram.
See, that patient would have been able to walk. But the patients did not wanted to make him walk. What can I do? So sometimes we are not responsible, Baba. Sometimes responsibility of some other people is also there. One simple statement in WhatsApp they gave, and I saw no one was rebuking. So I said, okay, I'm not going to Gurgaon for 3 months. If you cannot stand in group, if you cannot stand by your stand, then how will you make a group? Any people will come, anything they will speak, and if you don't stop him speaking, what will happen? I only have to fight my case. Why should I fight my case? What is my fault? Things which are personal should be discussed personally, which should be discussed publicly, should be discussed. We are matured physicians, right? Am I right or wrong? Don't you have my phone numbers? Don't you see me my group post? Everything you see. And we are least bothered that who is coming to the class, who is not coming. Our procurement is only that you should become disciplined, you should learn higher, you should have international certification, you should have international publications, so that when you go to Shanghai and other places, you are not looked down. You can speak mouth to mouth. I don't want to see any inferiority complex between you and others. I want that you people become at par with the international standards. So when you go to the students and interact with NUS University Singapore, and when you interact with the neurosurgeons, and when they ask you questions, you should be saying pata pat, kata cut. You should not be in a position of thinking, what should I reply? No. I'm preparing only for that purpose, how to interact with the neurosurgeon. Yes, the theory is with you. PPTs are with you. We are here only to discuss there. So some people were asking, why 9 pens are required? What will you do with 1 pen in this patient? And until you recover this type of cases in a growth period of time, and then the neurosurgeons over Manipal, they said no. And when we made it a success story in Karat, and when then we mobilized it without Walker, what will you say? And then we are trying to taper the dose of medicine, Sindopa, Pakitin. Now, how much good feel good factor we have? First thing I want to ask you, how much feel good factor we have? In the class, how is the feeling now? How is the model?
Hello, sir.
Tell me.
मैं
How are you
नायर
feeling?
बोल रहा हूँ
Naya,
सर
तुम्हारा आवाज तो जिंदगी भर पहचानेगा. You are my
सर भाई
inspiration, Baba. You
भाई
only made me
सर
to do so many fellowship courses. You know that?
yes
After joining one fellowship, I am returning to another fellowship. You are making me a student to work at
sir
hard. You made me a double student now. You brought me to critical care. You brought me to cancer palliative care. You
yes
put me to neuro anesthesia. You are putting me to neurosurgery. You are putting me to post deficit. You are the one who did it. You are the total responsible for that.
sir, sir today by seeing the 24-year-old person's case, the miraculous escape from his problem, miraculous recovery, we can say. So now I am having a patient of 17 years, sit on a chair, cannot earlier paraplegic. Now he can move his both hands, he can move the lips, and sometimes gradually that speech. Sometimes little bit he can talk. For a long period, he was under treatment in Vellore Medical College. He met with a car accident.
RTA.
Head injury. So
I just RTA. Whenever you say road traffic accident, it is called RTA.
Road traffic accident.
Means road traffic accident, traumatic injury.
So so Vellore people told him maximum whatever we can do, we have done it. So for 17 years he's sitting at home. So by seeing this miraculous escape of this 4-year case, can I bring this patient to Hyderabad, sir?
Do you think I will say no? Or do you think I will say yes?
Before that, I will collect the case history. And I will
generally
send
it is a brainstem injury. This type of cases have a brainstem injury. And frontal lobe is degenerated. Lot of degeneration is there. But even the power of neuroplasticity and neurogenesis is very good. You like to know. I like to introduce you to Balchandra Nayar. Balchandra, may I know your age, please?
I am 74 years young, sir.
74 young, sir. Okay. Please let us know your qualifications. is a geologist. After retirement, whatever you have done, please tell us.
1972, I have done my MSc in geology.
Okay.
Then I got selection in Geological Survey of India, working in Jaipur. Then I thought of doing continuing study from Rajasthan University. I completed MA in Public Administration.
Okay, very good.
So in office, I become an administrative officer also, in addition to my scientific work.
Oh.
Then after retirement, I have done this MSc in yoga from Annamalai University.
Okay.
Then went to Chennai Sports University, MSc in yoga therapy also I have completed.
Okay.
Then history and heritage management. Archaeology is my interesting subject. I have done some marine archaeology work also. So that heritage management, MA I have done it.
You have done MA in archaeology?
History and heritage management.
History and heritage management. Okay, very good.
Now MSc in acupuncture. That also completed. Now fully immersed and engaged with the treatment of acupuncture treatment karta hu.
He forgot to tell you. He has completed his 2 fellowship under me also. So Balchandra Nair is one of my oldest students. Yeah, so you can see he has a list of degrees. And what inspires me is always one sentence. You know what? He was going in the bus, right?
That is the beginning.
That was the beginning. And that sentence inspired me to take a lot of degrees again and again. Again and again, I am writing thesis. Again and again, I am writing papers, everything.
Activate my brain, memory part. To activate my memory part, I was doing these studies. Now, I entered into MCOM, previous completed, now studying for the final.
He's doing MCOM also. And now he's also enrolled in PhD program.
So in between,
now you compared yourself. Now you compared yourself with a person of 75 years, young person, and you compare yourself with him. Only to do his competitor, I took fellowship courses. Me and Balchandra Nair, when we stand together, it should not seem the teacher is less qualified than the student.
Sir, I will discuss with this patient and I will send the case history also. If we can rectify,
I always say one thing,
Yes.
Whenever you see a case history is not everything, right? How much the body is acceptance. As when I see his MRI, when I see all these things, when I see EEG, low response in the brain, right? Every neurologist, even the neurosurgeons were negative about him. If I go with them, I'll develop a negative biasness in my mind.
Exactly. Correct.
I cannot think positively because I'm already biased. Right?
Yes.
So I'm influenced by this thought that this person cannot recover. I cannot think how to recover.
Correct. I will discuss with this patient, and if possible, I will motivate him and I will bring him there.
You see, you brought me a 22-year-old myelopathy patient, right?
Now he's happy.
He's so much happy. He's not going to any doctor. He's walking with a stick and he's enjoying his life and he's solving the legal problems of the family. And his friend is my mentor. His younger brother is my mentor, He solves all our hospital problems.
Very good.
So you can see a 22-year-old myelopathy case after surgery, unable to walk, is enjoying his life 4 years after dischargement. And that patient was referred by Balchandra Nair. I've discharged that patient 4 years back. He did not deteriorate. The deterioration time is within 6 months, right?
Yes.
But if the patient does not deteriorate for 6 months, you see a 75-year man challenged a 45-year young boy. So I said, I cannot be challenged by my student. If my seated near me and he speaks so many things. I also be prepared of speaking so many things. So there is a competition between me and Balchandra Nair, who is more qualified. And so Shivani will say me one day, sir, Nair is more qualified than you. Then what will I do?
Not, sir.
There's so many degrees. MSc Archaeology, MA Political Science, History Heritage, MSc Yoga, MSc Acupuncture, uh, again MSc Yoga, doing PhD, MCom, 8 degrees. Maybe
So,
one or two more is given by me also fellowship. So how much?
yes.
10 degrees.
So, sir, this is if I will on journey by train, long journeys to Delhi, it will take 2 days from Kerala. So I can talk any subject with these fellows. Once one central,
Yes,
one
you can
central,
talk anything.
central secretariat, one official was there, one IAS man. So IAS fellows thinking that they are big administrators and all administrative theories they know and everything. So gradually talking, then at last, after reaching Delhi, he told, if you are free, come to my office or residence for a cup of tea. You have sufficient knowledge in public administration. He told.
See, I was also I tell you, I was also a man of public administration. I have executed 2 national projects under Supreme Court of India. So people have heard about national law universities, right? Yeah, all these universities come under supervision of Ministry of Law and Justice, and they come under direct supervision of Chief Justice of India, supervised by Chief Justice of the High Court. Now you imagine, without doing LLB, I executed 2 national law university projects as mission director. And then I became an arbitrator sitting beside the judges of Supreme Court. It's only your blockage of mind. Why I need the next pen. I say, why you need the next pen? You need the next pen for the next patient. You did not, what did you do, in your life? You created one boundary about yourself, right?
Yes.
One well. And then I don't want to jump out of that well.
Yes.
I always remember his history of Parkinson. So before we go to the neuroplasticity, I want to know the youngest man of the class. I think he's the youngest person in the class, right? Das, तुम्हारा एज तक है? Surya Nayan Das, what is your age? Unmute your mic. What is your age?
Namaste, sir.
Namaskar. Jai Jagannath.
Jai Jagannath.
What is your age?
My age is 70, sir, 71.
So the most oldest person of the class is, see how you see your age and you see their sincerity. Now I want to have a comparison between a person of 75 and 71 and young people. Let us see after some time who is going to publish papers, who is going to write thesis, and who is going to present. And then you will realize this 71 and 77 years person who have no knowledge about computer and technical knowledge are far better than you. You had so many boundaries in your brain, right? Now I'll tell you about a case. And Balchandra Nair, a person of 77 years, he treated a patient of Parkinson, right? He does not know much about Parkinson, but he treated, and he will speak his history. And that was my inspiration in treating this patient. Every time when I get a patient, I always think how much time I can reduce for his recovery. Right? And that is my innovation of one more. Every failure teach me how to be a successful man. I'm fond of failures. I was failed in what you called Gurgaon workshop, but each failure taught me how to make Gurgaon workshop much better. Because first workshop we had only 4 students. Imagine a person who used to teach 100 students in his seminar classes. He started back with only 4 students. But every failure taught me how to be a successful. And now, what is the advertisement we have? Do we advertise so much? No. How much is our marketing cost of this hospital? Nil. And the best thing of this hospital is if I am out for 7 days, all patients are discharged. The moment I come, everyone comes. The moment I go, everyone goes. So I cannot take a leave of more than 3 days from the hospital. So that is why early in the morning I come and I put up my in the Facebook. I have joined the hospital. And then in the late in the night, that is 4 o'clock, I go to the other station. I'm going to this, I'm coming back in this. And that is the reason I put everything on the Facebook because patients are monitoring when I am coming and when I am going. Right? So Balchandra Nair, before we go to the PPT, and we speak little bit about stroke. But this is what I wanted to associate. Yesterday, what we saw the video, then the neuroplasticity of stroke rehabilitation, and the practical examples near you. I am a man of practicality. I don't believe in theories. Right? I did the book knowledge, but then I am what I like myself to be called as a potter. Potter means who makes pots from clay. And one of my designation is I'm a good potter. Now I forgot of course, but I have learned. I paid 25,000 rupees to learn this. What you call how to make as a mission director. I learned how to make what pots. The clay pot is a mud pot. I learned that. I learned how to do this.
From shaping from clay.
No. How to make the sweater?
Acha.
Knitting, sir.
Knitting. Do like this and knitting. And now these skills have helped me in neurosurgery. And then I learned little bit of embroidery, right? Hand embroidery. Now I can show you those skills that I can take out one from a very tissue paper. I can make 12 sheets for one drop, and then from that 12 sheets I can take out one piece. I made one hole, and then when you open the napkin, you will not be able to see the hole which I made. From hole, I took out 12 fibers. From 12 fibers, I took out only one single fiber with the help of one acupuncture needle. And not with a microscope or anything, with my naked eyes like this. This is the part of what? Learning. You know who stopped your growth? Rajini said very beautiful thing. You are the biggest demotivator of your life. You blamed the circumstances, you blamed everything. You see, I learned that sentence and I stopped blaming anyone, right? Now you can see we made the class. Tomorrow we are going to have 85 inches board. We are removing this table from here. Then I will be teaching on this, what you called podium. So anyone who comes to me in group of 10 people, I can teach them NIBS properly, provided you have the tools. So anyone who wants to learn NIBS and all, they should have tools. Because if you learn and you just what you go home, you forget everything. Anything which is not about to practice immediately, you lose it the same day. Why do I make these videos? Why do I write a note writing? So that my drafting is improved every day. You see 3 months back my video, right? Let us just go on my Facebook and you see 3 or 4 months back my video quality. And now you see my video quality. How much improvement is there? If I see my previous quality, I don't even like to see those videos. I myself will not like to see those videos. No doubt they were very good cases, but the quality of the video was very Poor. And today you see the quality of the video which we have put on, how good it is. So everyone was starts with zero. But if I have stopped myself of starting, learning, and teaching, what would happen to me? So that is only called neuroplasticity of the brain. Whatever I showed about brain stimulations, recovery, physiotherapy, stem cell therapy, if all these are integrated, we lost nothing, but we revived a life. Tomorrow you will see a patient walking with AFO with one stick, and everyone in this country, wherever he visited, even his father-in-law said, "You will never be able to walk." And I said, "By 2 days you will be able to walk." Tomorrow he will be able to. The physiotherapist was giving him lot of support. Other people will give him lot of support. I said, "You remove all the support. Just give minor support in the back, and he's able to walk." Tomorrow we'll give him one AFO and give him one stick, and we will see he's walking. Tomorrow video will upload of that video will upload. So this is the feeling changes between your mind and my mind. So on one day he was asking me, "Sir, when we will run neuroacupuncture?" Now you tell me, what is this, Anil? Anything which you teach without evidence, anything which you teach without foundation is called what? Shivani, what will you call it?
Called hearsay,
Anything
sir.
without evidence.
No evidence.
Huh?
It's called hearsay.
Hearsay means?
Hearsay means it's just what people are saying. They said no proof, no evidence. So you said something and there's no proof, and you cannot prove it, but it works. But now when they see the proof, everybody is coming round. But they still want to fight it. They still want to fight it. All the neurosurgeons are not happy with the progress.
So keep fighting. What is am I going to lose?
Nothing. Inshallah, we will win at the end of the day. When the patient walks and the patient stands, we win.
One thing I tell you, there is nothing to lose. There is nothing to. It is all the ego of the thing.
Sir, there's much to win. When the patient walks, like your 24-year patient now, it's a victory.
But did you see any change in my face?
No, for you, it's normal. But for him, for him, he's going to live a normal life now. He's going to do so many things. So, for him, life has given him a chance, another point of victory. Yes, Alhamdulillah. For the doctors
this is why we say,
for the Dr. Sastry that said he would not walk, they would say, "Who is this Sastry? What does Sastry do? Who is this Sastry?" They're not too happy.
They always say, "Who's this Sastry?" Later on, they become my friend. So whoever you see, Nikunj Mittal, Nilesh, all this Cherian Saab, all were my best enemies, We had a big fights. And now you see, they are my best friends. Yes, not only friends, they are like my relatives. Now, for example, if I go to coma and I put a photo in coma, you will see the biggest concern about my health is to with them. They leave their hospital and they will come to see me.
That is how good friendship starts. It normally starts with a quarrel, and then you become best of friends. No more quarrels.
Where there is quarrel, we always say we all work together. I always say DBS is most important. But they say this is the unfit candidate of DBS. I said I'll make it a fit candidate for DBS. Will you do it? Well, if you make it fit, I will do it. Okay, I'll put on the Facebook. Let all the neurosurgeons, let everyone see he is fit or unfit. Let the social group decide. I posted this video in the Facebook. Let the social group decide. Let the group of surgeons decide whether this patient is fit for DBS or non-DBS.
Actually, after your treatment, Sastriji, with the techniques and the patient comes up, my opinion is to continue with that treatment. To give him any other, take him out of that would, my people say here,
See, one thing I tell you, it cannot be, no, I always say, treatment cannot be infinite. It has to stop somewhere, right?
Yes.
Every treatment has to stop somewhere, right?
And take a new dimension.
Yeah, it has to stop somewhere. Every treatment what we do has to stop
somewhere.
And
take a new
So
dimension.
we have to stop this case with a better recovery, with walking. And we want to, I have shown you this walking today. And after a month, we'll show you the walking after DBS. I think you will be able to see a normal walking.
DBS using
yeah, you will put an implant inside the brain.
Okay. That would be interesting. That would be interesting.
Yeah, because I have made around more than 50 cases of DBS successful. Now again I back to pavilion. I have to make more than 200 cases of DBS successful. So all those people who have health insurance, we can perform this DBS in 15 lakh rupees or 16 lakh rupees under DBS with the best equipment for 20 years to survive.
Oh, this is great.
But if you do in other hospitals, it is 70 lakhs, 77 million, but in Indian currency. But if you do it in Karat, it becomes only 1.7. 17 lakh. 1,700,000. That's all.
That is interesting.
Where the cost of the device is only 15 lakhs.
15 lakhs for the device.
And 2 lakhs for the surgery, including OT and other complications,
So
ICU
that's
charges.
17 lakhs. How much is that in USD, sir? So we get an idea.
How much is in US? Can anyone calculate? I don't have the calculator. 17 lakhs divided by US dollar. Anyone has calculator, computer calculator? Anil, देखो बेटा.
Let me see
Google
if I
में
can
देखो
get
कितना
it.
आता है.
17 lakhs.
1,700,000 Indian currency divided by in dollars.
Sir, $20,000.
It's around $20,000.
Okay. Okay.
With discharge. ICU admission, OT charges, implant, and discharge.
That is good.
And the implant is for 20 years. There are two types of implant. One is for 5 years and one is for 20 years. So according to me, we don't have to change the implant for next of our life.
That is
So we'll
good.
go to
20 years is a long time.
Yeah, because she is now almost 55 or 60 years. So by 80 years, she will go to heaven. This is what my belief. Though this implant is last once for all. In India, we say married and continuously married. So we are going to get her married with this implant and will continuously get her married and will not see her in bed for another 15 years. Maybe because of arthritis and other factors, she may go to bed. But we don't want to see her in bed for Parkinson's.
Inshallah. Inshallah.
That is what we say, inshallah. And that is why we call mashallah.
Yes.
We start with inshallah and we
then
end with
go to
mashallah.
That's
what I always say. When I start a case, I say inshallah. And when I finish the case, I say mashallah. Alhamdulillah. It was only you did and only your grace and only we see. And that's what I say. You see, why you people cannot learn? You are never able to write in the group what I have learned today. Because you did not revise yourself. You did not motivate others. You did not do good to the others. So no good has happened to you. I always took my classes free of cost, right? I did everything free. So you see, without having much higher sophisticated device, higher sophisticated things in our hospitals, we do the maximum cases. And our achievement is around 80 to 85% recovery. We are much better than we have the best. We are among the best centers of the world. You can say, right? With the most simple infrastructure, we are among the best hospitals of rehab in the world. You can compare it. You can compare their results of Legon Medical Center and you can compare our results over here because our videos are viral in US, right?
Mm-hmm.
Yeah, they are doing research on our videos and discussions are going on in US. Among the neurologists, among the groups. How is this possible? Answer is simple. It is possible. I have no answer to say. So you can see this slides.
Yes, Sastriji.
Yes, sir.
See, finally I'm learning things, right? You imagine when I came in the first day in the class, I don't know how to run the mouse, but I'm taking the classes today. How much changes? I think it's the sixth class, right? Huh?
About that, sir.
So we'll study about different strokes for different brains. What is the time?
That is 9:30.
The class is almost over. So we'll put up the one or two slides. So third leading cause of the death in US, first leading cause of disability in US. So you can say it's the first brain stroke is the first disability in the world. 7,95,000 cases per year in US. But in India, if you see, it's in millions. Around 10 million cases goes to 1 CR of the population goes to stroke every year. Or 5 million population goes to stroke every year. This is the statistics. Broadly divided into two parts. What are they? Ischemic and hemorrhagic. So 87% is ischemic and 13% is hemorrhagic stroke. 46% of all ischemics are caused by sudden occlusion of large cerebral artery. So you can see, basically, if you see occlusion of the basilar artery and all are the regions of ischemic strokes, right? Lack of flow of the blood inside the brain, killing the brain tissues, right? Sacrifice of the vessels, blood vessels, and sacrifice of the motor tissues. One large vessel, ischemic stroke occurs every 90. Worse prognosis versus small ischemic stroke. It is the first of a stroke, your brain loses estimate. See, this is the sentence which I wanted to say. In the first minute of a stroke, your brain loses estimated 1.9 million cells and resulting in the loss of 14 million synapses and 7.5 million pathways, what you should lose in 3 weeks of normal aging. So you imagine how much case is damaged. This line is very important for you, young generation. Write down this sentence, right? The slides are with you. And you should make notes, Baba, Shivani. Only watching me will not do. You are already married, okay? And I am a sannyasi. Your husband will fight with me again. So you should write, your brain loses estimated 1.9 million cells, resulting in a loss of 1 billion synapses, 7.5 million of pathways. What do you lose in 3 weeks of normal aging? And this is a publication from January 2006 stroke case. But the loss continues every minute in the stroke is left untreated. If a stroke runs into 10 hours course, it can kill 1.2 billion nerve cells. But a normal brain loses after the course of 36 years. This is the most important thing I want to tell you. You lose this in how many years? 1.2 billion nerve cells you lose it. And it's a publication from California University, Los Angeles. Jeffrey Surfer interview in 2007, oblique 2013-4, oblique 2. Time is brain. If you do not give non-invasive brain stimulation and the recovery, if you don't do in faster way, You see, you lose how many? In just 10 hours, how many cells did you lose? 1.2 billion nerve cells, which you lose over a course of 36 years. How many? So every case which you are pending, you're losing nerve cells like anything. Prior to 1998, the answer was no. All you could do was kill the neuron, whose trauma, stroke, and stress. So before 1998, when we studied, we had only answers of what? No, nothing can be done. Dr. Spikerman, Jed Kemperman, Fritz Gates discovered neurogenesis. This was the most important discovery of the world. But in our Vedas, it was most previously described about neurogenesis with various words. And in Ayurveda, it is said Bhattar Hajar Narya. I think not 72,000, more than 72,000 vessels are there. And collaterals are built up. In Sutra Samhita, it was said. I forgot the sloka. But only in two areas of the brain, the hippocampus and the olfactory bulbs. How can you stimulate neurogenesis? Now, this is the concept where we must understand. How can you stimulate the neurogenesis? How can you multiply the neurocells? These are the questions which you have to answer. Where is the tool? Where is the pain? Where is the stimulator? All those people who are talking to me, we want to recover. Are they really interested to recover a patient? If they are interested, where is the equipment? Where is the device? Where is the knowledge? If I give you the knowledge, where is the equipment? You are ready to sacrifice life of the patient for another 10 years, billions of cells, but you are not ready to sacrifice little amount of your time to his recovery. Now imagine how much neurons he has dead in his brain and how much neurons we have recovered in 140 hours. 22 years of paralysis patient, how much brain has been dead, how much areas of the brain has been dead, and from there, how we revive this patient. That was the most important thing I were to place before this panel right now who is sitting next to me. So what were the drugs which we had? Antidepressant drugs, statin drugs, and lithium. That is anti-epileptic drugs. So these were the drugs which we used to prescribe for what stroke patients. Again, some people are drawing. See, who is drawing this? Stop drawing on the screen. Antidepressant, statin drug, and lithium. These are the only drugs we have. And up to now also we have these drugs also. So if anyone is saying that for brain stroke and paralysis, I've taken so much medicine and recovered, then please say you have taken cardiac medicines and preventive medicines. You have not taken any medicine for the recovery of paralysis. Up to now, there is no medicine which has been provided for neurogenesis, angiogenesis, synaptic plasticity, to build strong synapse connection. Nothing has been built up. So one of the best ways to stimulate the growth of the neuron is to exercise. Again, there were a lot of limitations in the muscle. So this again part brought a lot of questions in our mind. Which kind of exercise? How much of the exercise? What type of exercise? So we have generated some protocols on the basis of experience and things were written. And we're saying about the fascia, this release, that release. But now the question comes, hardware will stimulate the software or software will stimulate the hardware. So we always call it is vice versa. Software will give power to the hardware, hardware will give the power to the software. You're working on the hardware, but if you're not working with the software, now you have the best hardware, but you are working with XP. So if you think, if you ask me, Satriji, how much is your knowledge about computer science? I'll say as much knowledge you have as about NIBS. I'm a man who has worked with Intel Duo Core, and in my time, these laptops were very costly. So we used to use this white dabbas. I think now they are not even found in museums. I think the young generation have not seen this white dabbas. How many people are now seeing white dabbas in the house? Any white dabbas? Dibba means the white computer which we used to have. I have not seen them from last 15 years. So you can understand my knowledge in computer is 18 years back. So I used to use Celeron dual core processor. That was the latest at that time. So I don't know now what we are running with. I think Celeron dual core is finished, I think.
Yes.
Now what is coming the latest?
i7, sir.
i7. So what is
Yes.
the difference between Celeron? How much difference has come from dual core to i7?
It's too much, sir. Very far.
Now you can understand. If you don't upgrade your computer, your brain, you will become Intel Duo Core. Celeron Duo Core processor. And when the world is working with MS12, you're working with MS4. And then you will blame, सर पेशेंट नहीं है, ये नहीं है, वो नहीं है. तो क्लिनिक को किसने चौपट किया? तूने अपना लाइफ को खुद चौपट किया. And you are blaming the society. You destroyed your own life because of your lack of English, you see. In 1 minute, you lose how much? And in 10 hours, how much you lose? And in 1 year, how much you lose? In 2 years, how much you lose? And then you say, I want my patient to recover. So this, in our way, this is called a very good relaxation exercise. Now we are studying on this. I am looking just for 2 lakh rupees. And I'll show you how meditation in physiotherapist, breathing exercise brings a much better decision process in your mind. And that you can monitor it. After 10 days, you can monitor how better you are. And before 10 days, how better you are. So when you're putting the needle, I can monitor how much is your heartbeat, how much anxious you are. And when you come for the next workshop and you follow certain techniques, and then you can see in the monitor how better you are. It is your anxiety and unnecessary thoughts which has destroyed the case, not anything else. Unnecessary thinking, overthinking of your brain has destroyed the case. That is called over anxiousness, over greediness, overthinking. But if we become stable with a nice thought, nothing will happen. Does the brain has the capacity to forming new synapses? Yes, it is called plasticity. It's a range of motion start from PT, OT within 24 hours to 48 hours if possible. Exercise, recruitment of pathways. Mirror neurons, monkey sees, monkey do. Look in a mirror, move the right arm, and the paralyzed arm will also move. This is called mirror moving. But then again, we translated all this thing into different pathways. Put the needle, brain will do mirror moving. We put the same thing. You asked me, na? You put on the same side of the paralysis. I did the mirror. I created here, and the mirror is followed here. I did the simple things, but you made it a complicated thing, right? So everything, whatever I have done, is with the scientific evidence. But the only problem with us is that when we go higher and higher, we forget the lower and lower things. And that is the reason I keep teaching, I keep learning, and I keep pushing. And that is why I say the best student of the class is MK Sastry, and the best teacher of the class is MK Sastry. You learn or not, I don't know. MK Sastry is always learning. Because when we go to IIT and all, we have to discuss at a very high level, right? We have to finish the class within 5 hours, and we have to come next time with a good output. You see, we started with brain muscle pain in the Gurgaon seminar, and we went to 9 pains. And now, up to now, how many pains do you have? Only one. Because you never took an attempt to recover the patient. You never tried to go one step higher. You only stopped yourself. No, 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 no. Everything what you have in your mind is no. And then you will say, this is how we were taught. Who taught you like this? So we'll put this today here only, right? Remember, this is the slide, huh? Please store it today, this slide. Tomorrow again, I may ask you. I may not have in my group. So you have to push it again in the group, right? Stop this slide here and we'll have some discussion. Now you tell me, who has destroyed your life? Who is responsible for your life? You. Osho was moving once, very good philosopher. I like his teachings, right? Osho used to say, he saw so many Jain monks putting so many bandages on their leg and they are walking. With all due regards to their spirituality, I really admired them, their sacrifice. But when they came to him, he saw so much bubbles in their leg. And then he asked, you provide leather, right? Why don't you use this uh, clothes, shoes made of clothes, resins and clothes, which kills no human being? So use suits out of clothes. Then they say, it is not written in our scripture. He said, okay, you bring your scripture and I will write it. तुम अपना शास्त्र ले आओ मैं लिख देता हूँ That's what I say. If something is not written, it is not the false. It is same like Tesla, who said the rocket cannot come back to the earth. He said it. Someone has not read a theory. It does not mean that I will not change the theory. He changed it. The rocket which went in the space, it came back to the same launcher from where it was launched. A new theory has come. He failed 5 times. The company was about to be closed, but he proved he was right. So you see how differences lie. All people want certificate. I say you print out the certificate and put in a wall. Who stops you? But knowledge without certificate is like what? Drinking water in the rain, like this. Ah, open your mouth and drink water from the rain water, like this. Ah, drop by drop it will go. How much it will drink, you do not. You are doing unscientifically. It is better that we become a scientific and knowledgeable person. Every step of our life teaches us to be a better human being. The more better we become, the higher better we do things. We have become so greedy. We have become so neptoist. We are very sorry to say. And for this, we blame others. I have not been taught like this. I have not been taught. Your husband is calling you, Shivani. You see? From here, I can see who is calling what. And you said, okay, I am coming. Just 5 minutes. You see? Without being married, also, I know how husband speaks to his wife and wife speaks to his husband. You see, I'm sitting here. I don't know what is going in his house. But from my classroom, I can say what is going in your house. An unmarried couple knows about the best of the married couples. He was asking when the class is going to over. She said, okay, now just about to be over. Just 5 minutes. He said, okay, okay. And then Shivani is saying, oh, I have to give dinner and all. So don't worry, we are going to free you from the class. Tell your husband, 5 minutes only we will take. Then you can leave. We'll put up the floor on the question and answers. So you see how beautiful is the class, how beautiful is the mind, and how beautiful is neuroplasticity, and how beautiful is recovery. You destroy a thing for 22 years and you recover in 140 hours. So how many is 140 hours? 24 into how many days? 7 days. 6 days. And 22 years is how many days? 22 to 365?
70,000.
Huh?
70,000.
20,000. 22,000 days. Now 22,000 days minus how many days?
7 days, 6 days.
6 days. So how many days we are in advance? Huh? The work of
1994.
we are advanced in 21,994 days. Now imagine how fast is NIBS and how fast are these pains. You were asking me, what is the importance of this pain? This is the importance of the pain. We have messed up 21,994 days in 6 days. Official treatment is how much? 7 hours only, na? So we have to calculate this 7 hours. We are not going to calculate this 24 hours, right? When we speak official things, we speak officially. 140 hours. And how many days of paralysis? 22 years. With massive brain damage. This is why you need a good tool and good knowledge. And that is why I'm not able to teach you the advanced things. Why? Because even if I teach you, what is the use? It's just like wasting the time. So whenever you come to me, I always say, I want to make you to that level. But then I have the same answer. Same question, same answers. And when I will die, this knowledge also will finish. I am not able to fulfill that task. So when you will read my books, you will be again confused. But at that time, who will clear your confusion? When I was alive, you did not want to do things. When I am about to die, you want to read my books. But when I am alive, when I am teaching you personally the shortcuts, I am giving you my puriyas. And only insist you, go and practice, make money, grow yourself. But then, sad, sad. Anything ask, one beautiful answer you will get. What do you know? Sad. I said, oh, Meda sir, my head in hell. And only these people will come and criticize because they are not able to understand me now. But when I die, you will also remember me like Galileo Galilei. That yes, patients can recover. It was so difficult for me to meet with 200 neurosurgeons and a single man that acupuncture works. Now they cannot say it does not work. Why? Okay, sir, you recover the patient. I put the patient to your table, you recover it. Put your best physiotherapist. Let me see in how many days he recovers. And it is not that we don't have the case history. We don't have the case files, right? It has been monitored by the senior physicians. Every day, vitals, everything are monitored. ECG, EMG, NCV, all these are on records. cannot deny the scientific data, right? Only the problem is we have to integrate. We have to integrate with DBS, with Parkinson's. We have to integrate things. We have to come out with our greediness. We have to come out with that competitiveness of our brain. We have made our so competitive that we see what is in others' plate. We forget we have a beautiful plate in our plate house. We can do so much achievement, but we stop ourselves. And then when you come and tell me so what to do, I also make the same story like you. Shivani always will come and ask me, so what to do with my cousin? Hey, घर का relative को मत दो. बोले क्यों मत दो? Again, if I say I have to buy the pen, she'll repeat the same story which I have been hearing from 6 months. Then what I will say, instead of getting new story, I repeat our whole story. So whatever you see, I also say the same story. बेटा तुम मत लो बोले क्यों घर का रिलेटिव को नहीं लेना चाहिए अरे क्यों नहीं लेना चाहिए what is the fault of that child but if I say who will buy the pen who will buy the tools who will learn who will do I don't have time you keep these 10 sentences and then what I sentence say बेटा घर का रिलेटिव को मत लो I said बेल मुझे मार if I tell you ले लो you will come again second day say it is not happening third day is not happening how can you make things happen with one medicine can you recover meropenem with peptas no when meropenem is required it's required now I compare you with the patients I think patients are more better than you they're paying more money than you for you paying 10,000 rupees in the class is very high but for them paying 50,000 to 1 lakh rupee is very small because I always see 2 crore bills 3 crore bills 5 crore bills in the hospital discharge amount and you see what a market you have and what a market you have destroyed every year you have more than 5 million patients of paralysis 5 million patients and there is nothing called beyond science it is science better it is all what's written in the book I am teaching you only the first semester of the first year of the book human physiology by Gyanam but integrating higher subjects I am integrating the slides of neurosurgery I'm integrating something from neurosurgery. I'm integrating something from functional neurology. And I'm integrating what? This from that, this from that. And it becomes a higher slide. But originally, if you see, I'm teaching you the first year neurophysiology only. Now you imagine how much harm has happened to the society. And we are not ready to correct it. In last 5 classes, I never saw people putting one positive sentence in the book. What did I learn? Since you cannot express what you learn nothing. And how much you can learn, that also you don't. You see, after 1 year, you see how much you are better. When I see these Indonesians, they are doing so wonderful work. Filipinos, I do so wonderful work. When I went to Philippines, I saw, my God, how will I teach them? These are all massagers, not even physiotherapists. First thing I said, Bhaiya Rama, Hi Ram. Then I said, Modla. Now it has become Sitara. They are doing wonderful work. I just mentored them for 7 years. And I tell you, I'm most respected in Indonesia, Philippines, and Nigeria than in India. So, I put up myself in the questions of the floor. You may ask me. I don't speak Tamil. I was asking me. I was speaking in Tamil. My accent has become Tamil. So I said, no, it's English. Are you speaking Tamil? No. My tone has become like Tamil and South Indian. వచ్చేది తెలుగు రాదా? So I put myself on the floor. You may ask me questions. And after 10 minutes, we are going out. It was almost 10 by 3. So three questions we will take for today. It's 10 o'clock. Who is doing what? Why are you touching the body this?
Mohan Kanan.
Mohan, what are you doing? Stop it.
So you have to take him out.
Mohammed, if you don't stop it, I have to take you out from the classroom. See, why are you doing all this? Ask me questions, please.
Sir,
Hmm.
my name is Akash.
Sir, what is your qualification, sir?
My qualification is naturopathy and yogic science. I recently graduated.
In
And
BNY?
yes, BNYS.
Which college?
From SVS University, sir, in
Oh,
Bangalore.
SVS.
I'm
Your principal is very well known to me.
yes, sir. I'm Anil's classmate.
I'm known both the colleges, one SDM and one SVS. And SDM, I'm very close to SDM people. So I'm going to be the visiting faculty of SDM very shortly. And SDM will be the first college to integrate with neurosurgery and neuroscience. And we are planning to have one telemedicine center, an OPD center of neurosurgery, neurology, with Karat and other places.
Yes, sir. Sir, my question was, I have two questions, sir.
And your dean is very good. SDM dean is very good. Sethi madam. M.A. Sethi. I don't know what is her name. I call Sethi madam. What is her name? I don't know. But she's
Geeta
very
Sethi.
good lady.
Geeta
Geeta Sethi. Who told her name? Who know Geeta Sethi?
Me, sir. Anil.
Geeta. Geeta is very nice. A very, very nice, very energetic lady.
Yes, sir. Sir, I had two questions, sir.
Yeah, tell me, Baba.
One was treating one post-stroke patient, ischemic stroke, and from 6 years he has spastic paralysis on left side. So I had given him 10 sessions of acupuncture, but he only showed improvement in his leg. The spasticity in his hand didn't decrease.
Neither
So
the
I had
spasticity in the leg has decreased, nor the spasticity in the hand has decreased. Because the question is, you have not worked with the upper motor neuron.
okay. Yes, sir. So right now I have referred him also to visit you in Karad because
Baba,
he's
don't
near.
refer in Karad. Don't refer to Karad any patient. I'm very
Okay.
busy in Karad. Karad, I am
So
like a different person. In Hyderabad, I am different. In Gurgaon, I am different. In Karad, I am totally different, Baba. Don't ask me to
oh,
see any patient in Karad. Maximum, I will see like this, and in 3 months, I will say, I can do things in Karad. Baba, Karad is a big political place.
okay, sir. You tell me, sir. This is my next question. Where are you available so that I can at least send him
Now
to,
tell me, where should I be available? In every post in Facebook, where do I write?
sir, Hyderabad?
Hyderabad.
Yes.
Hyderabad.
See, you know everything about me, and you are asking me. पूरा जन्म कुंडली है हमारा तुम्हारे पास, हाँ? Where am I? What am I doing? How am I doing? And then you are asking me. So
Yes,
राजमा
sir.
चावल is ready. शिल्पा
From
this
you,
राजमा
yes.
चावल, राजमा चावल बनाया क्या? क्या बनाया? कढ़ी चावल?
दाल चावल।
चावल के साथ क्या बनाया?
दाल।
Because he only gives me curry chawal and rajma chawal, so only I know about two names. I memorized it, so I don't know much about the food, right? Because we eat from the hospital canteen, and this food is we don't know the name of the vegetable they give. So now I'm learning new things. Curry chawal, rajma chawal, sabji. This is that sabji. I don't even know the name of sabji because what we get in the hospital canteen is not even a sabji. It is something mesh of sabji. Ah. So you can go for curry chawal, right?
Okay, sir. Bye.
Good night. Sayonara. Bye bye. Tell me.
Yes, sir. My second question was, uh, in acupuncture, you're using only tongue's acupuncture, or is it a formulation of your own? The neuroacupuncture part of what you give this treatment, sir?